The disease that I chose to research throughout the duration of this course and for my final project is ovarian cancer. And for this project, I chose to go over the natural history of the disease. So symptoms associated with ovarian cancer is abdominal pain, urinary urgency or feeling like you have to pee, pain during sexual intercourse, changes in a woman's period, rapid weight loss, and fatigue. How is it diagnosed? Unfortunately, ovarian cancer is usually diagnosed at an advanced stage. Only about 20% of ovarian cancers are found early. However, when they are found early, the survival rate is very high. The first step in getting diagnosed with ovarian cancer is with a pelvic exam, and if it is suspected that you do have ovarian cancer, you'll be sent to a gynecologic oncologist who will test further. The first test done after the pelvic exam would be an ultrasound, and other tests done include CT scans, MRI scans, PET scans, biopsies, and other endoscopies, such as a colonoscopy. Risk factors associated with ovarian cancer. The risk factors are both hereditary and non-hereditary. They include a family history of ovarian cancer, if you previously had breast cancer, being of older age, typically post-menopause, so late 50s, 60s, having an early period if you have an early period before the age of 12, it's a higher risk of ovarian cancer, a high-fat diet, obesity, PCOS, and gene mutation. Mutations of the breast cancer 1 gene and breast cancer 2 genes, mutations in those genes account for 10 to 15% of diagnosed ovarian cancers. How many patients are diagnosed with ovarian cancer each year? In the U.S., around 21,000 people get diagnosed with ovarian cancer each year, and of those 21,000, 14,000 will unfortunately die of the disease. White women are most at risk for ovarian cancer. In one statistic that I found, out of 100,000 women, the number of new cases of ovarian cancer for white women was 12.2, and that was the highest out of all the other races and ethnicities. I have that linked in my sources. And the reasons for this, why it's so high for white women, has to do with genetics, a higher prevalence of endometriosis, and higher access to healthcare. As we learned about in the racial disparities, white women have more access to healthcare, and so if you have higher access, then it's more likely that you'll get diagnosed and it will be recorded. The prognosis of ovarian cancer, there are 4 stages. Stage 1 is localized, meaning it stays in the ovaries. Stage 2 is regional, so it's gone to nearby structures such as the uterus or the cervix. 3 is distant, and then stage 4 is it's spread to the lungs and tissues in the liver. So for the 5-year relative survival rate, which in the 5-year relative survival rate pertains to the percent of patients alive 5 years after they've been diagnosed compared to the general population of the same sex and age as those diagnosed. So for invasive epithelial ovarian cancer, epithelial meaning the cancerous cells lines the surface of the ovaries. Localized, the survival rate for localized is 93%. The survival rate for regional ovarian cancer is 75%, and then the survival rate for distant is 31%. So obviously localized has the higher survival rate. For ovarian stromal tumors, the localized survival rate is 98%, regional is 89%, and distant is 60%.